Good afternoon, everyone, and thank you for joining us for this afternoon's information session for families and caregivers with speakers from the Ministry of Long-Term Care. My name is Sam Peck. I'm the Executive Director of Family Councils of Ontario. It's my pleasure to host today's session. We'll start with a land acknowledgement. FCO's work and the work of long-term care homes, family councils, family caregivers takes place on traditional Indigenous territories across the province we now call Ontario. And our team is thankful to be able to work and live on this land. First Nations peoples were the original inhabitants of the land that is now called Canada, and there are actually 46 treaties and other agreements that cover the territory of Ontario. I'm coming to you today from Hamilton, which is situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This land is covered by the Dish with One Spoon Wampum Belt Covenant, which was an agreement between the Haudenosaunee and the Anishinaabe to share and care for the resources around the Great Lakes. And settlers, and descendants of settlers and others have been invited to share in this agreement to support the ongoing care of these lands. This land is also covered by the Between the Lakes Purchase of 1792, which was between the Crown and the Mississaugas of the Credit First Nation. We are so appreciative of the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and who continue to contribute to the strength of long-term care homes and communities across the province. For those who don't know, acknowledging the land is an Indigenous protocol used to express gratitude to those who reside here and to honor the Indigenous people who have lived and worked on this land historically and presently. It allows us the opportunity to appreciate the unique role and relationship that each of us has with the land and provides a gentle reminder of the broader perspectives that can expand our understanding to encompass the long-standing rich history of the land and our privileged role in residing here. You can learn more about the peoples, territories, and languages of the land on which you live, work, and care at a great website called native-land.ca. At FCO, we're early in our journey towards true reconciliation with Indigenous peoples, but have committed to establishing mutually respectful relationships with Indigenous peoples across the province, because we're grateful for the opportunity to live, work, and care in communities across Ontario. Before I turn it over to today's speakers, a few logistics. You'll notice that you're in what's called listen-only mode, so you can hear us, but we can't hear you. We've protected time today for an interactive question and answer period. Throughout the webinar, please use the Q&A feature to submit your questions. The Q&A will also enable you to upvote questions that you want to be answered by the presenters. We'll answer as many as possible within the time allotted. The chat is going to be disabled. If you have any technical issues, you can use it for the next couple of minutes to connect with the speakers or with myself. And after that, if you have any issues, please send me an email. You can reply to the confirmation you got for the session or email me at speck@fco.ngo. Today's session is being recorded and will be made available to participants following our time together on the Family Council Ontario YouTube channel and will be promoted in our upcoming e-bulletin. And now, without any further ado, it's my pleasure to introduce the first speaker, Christine Loureiro, a director at the Ministry of Long-Term Care, to begin to walk us through the pandemic response updates. Over to you, Christine.
Wonderful. Thank you so much, Sam. And I'm pleased to be here this afternoon, along with my colleague, Erin Mannix, to provide an overview of the recent changes that the ministry communicated last week to our pandemic response measures. So just as a context to kick off before, so we can go to the next slide, Anastasia, thank you so much. I just want to acknowledge the sacrifice you've all made as family members and as caregivers to supporting your family members and ensuring the health and safety of all the residents in long-term care, as well as staff and visitors. It's with thanks to this collective commitment and sacrifice over the last 3 years that we're now able to wind down some of the measures that have been in place for quite some time. We're approaching what has been, a bit of a challenging respiratory season. And although we anticipate that COVID will continue to circulate around the current levels, with the high uptake of vaccine amongst residents, access to therapeutics, the high levels of immunity at the community level, that risk of severe outcomes for residents has really decreased. So that's why we've been working really closely with the Office of the Chief Medical Officer of Health on a plan to ease the measures in the COVID measures in long-term care homes to optimize and prioritize the safety of and well-being of residents and staff. So with that, I'm going to turn it over to my colleague Erin, who will walk through the change and provide an overview of those changes for you. So over to you, Erin.
Thank you, Christine. Hi, everybody. So the first change that we can talk to you guys about is that everyone does still need to wear a mask indoors. So that piece is not changed. What's changed in regards to masking is that the recommendation for residents, caregivers, and visitors to mask outdoors is being removed. So staff are still recommended to wear a mask outdoors when in close proximity to a resident. And in all areas of the home, when indoors, staff, caregivers, volunteers, visitors all need to remain masked, with the exception of if they are alone with a resident in their room or a designated space, provided no other resident or no staff are in that space. For asymptomatic screen testing for those entering the home, that is no longer required by the ministry for staff, students, volunteers, support workers, caregivers, and visitors. And while long-term care homes still have the option to implement their own asymptomatic screen testing policies, it is not recommended by the ministry at this time. For active screening for symptoms before entering a long-term care home, that is no longer recommended by the ministry. Instead, staff, visitors, caregivers will need to self-monitor for symptoms known as passive screening. This can be done through signage at the entry to the home. And long-term care homes will be promoting self-monitoring for symptoms and other infections, such as COVID-19 and other infectious diseases. And again, that speaks to that signage piece at the doors at the entry to the home. Long-term care homes no longer are required to monitor residents daily to detect the presence of infection, including COVID-19. However, long-term care homes are continued to be required to monitor residents daily to detect the presence of infection, but they are no longer required to conduct daily temperature checks of residents. Additionally, when the resident returns to the home following an absence, they do not need to be actively screened after that absence. Another piece for family and caregivers is the ministry's limit of one caregiver visiting at a time during a COVID-19 outbreak is being removed. And during an outbreak, long-term care homes must follow and continue to follow public health unit direction, which may include restricting general visitors from attending the home. However, caregivers continue to have access to residents even in an outbreak. In terms of physical distancing, long-term care homes are now able to hold activities without adjusting to optimize for physical distancing. And with the guidance from public health units, long-term care homes are best positioned to structure the activities based on the capacity and the size of their home and their resident populations. In terms of COVID-19 vaccination, the ministry is encouraging homes that have proof of vaccination requirements to revisit their policies with consideration to the current context of the pandemic and the Residents' Bill of Rights. So these changes do come into effect tomorrow as of March 31st. However, be mindful that some homes may take more time to make this transition and update their policies. And now we can move over to the question and answer portion. So I'm going to pass it back over to Sam, and she's going to help moderate the questions while Christine and I are available to answer them.
Great, thanks. There are a lot of questions, so I'm glad that we've left a generous amount of time for this. So the first question that's come in is around masking. Are masks required for staff outdoors when close to residents, or is this a recommendation? This is for outdoor close proximity staff to resident.
Thanks, Sam. I can take that one. So correct, the masks for staff outdoors is recommended. It's not a ministry requirement. Homes, of course, may implement policies that may go above and beyond, but in terms of a ministry legal requirement on a home, it's a recommendation, not a requirement, that staff wear masks when outdoors if they're close to a resident. And of course, as you've alluded to, indoors, it does remain required that all staff remain masked.
Okay. So I'm just checking. We have had some questions that came in advance. Just seeing if there's anything. Will rapid testing, will this testing kit still be provided to long-term care homes?
Sure. So the rapid antigen testing kits do remain available to long-term care homes free of charge until June 2023.
Okay, so until June 2023. Okay, that's a duplicate question. Will vaccines continue to be given to residents, and how often will vaccines be offered?
Sure. So vaccines do remain available. We do anticipate a round of a spring booster might be announced in the near future, so stay tuned for that. We have recently received the recommendations from Public Health Ontario, which are available on their website, recommending that those living in long-term care homes, retirement homes, etc., do receive a spring booster, or receive a booster, especially if they haven't received one in the fall. So we do anticipate some communications from the Ministry of Health and the Ministry of Long-Term Care in the near future about a possibility of a spring booster. What we're still working on with the Ministry of Health and the Office of the Chief Medical Officer of Health is, what does that look like kind of longer term, and do we foresee kind of a cycle similar to what we see with the flu vaccine, for instance, going forward? So that piece is still uncertain, but I think we can all anticipate a likely spring booster in the near future.
Okay, and to clarify, the testing kits will be available through end of June this year, or was that the date? Okay.
Yeah, June 2023.
Okay. Okay. What about this is going back to masking. What about for volunteers working with residents outside? Are they under the same requirements for masking as our staff?
Erin, do you want to take that one?
Yes, sorry, I lost my unmute button. I was like, oh, where is it? Yeah, so volunteers are under the same requirement as support workers. And oh, I want to just confirm that. Might have to circle back to this one because I don't want to. Sam, if you want to go to the next question and I can circle back, I just don't want to provide misinformation.
Okay. All right. Okay. So this is another question about one of your opening remarks. You mentioned that the risk of severe outcomes has decreased. Can you share the data, the statistics around that to address if COVID remains a top cause of mortality in Ontario?
Sure, thanks, Sam. I don't have the kind of numbers right at my fingertips, but we have seen a significant decrease in some of what we call like those severity indicators. So the proportion of people who've been infected with COVID who are ending up in hospital, who are requiring life-saving intervention, or who are unfortunately passing away. Unfortunately, there are still deaths as a result of COVID. Through this most recent wave, the fatality rate amongst residents of long-term care has been around 2.5%. But when you go back to the earlier phases of waves, it was more around like 30%. So a significant reduction in severity from where we were in those initial phases of the pandemic.
Okay. Continuing on, I'm trying to, so just for folks posing questions, I'm trying to group questions together that are related. So for testing as well, for rapid testing, if there's two related questions about homes that are stopping rapid testing as of March 31st or April 1st, if the government is still making tests available through June, does the home need to report back to the government that they have excess tests, or do they still have the option to continue active screening?
So for the asymptomatic testing, rapid testing, homes still have the option to continue testing if they choose to do so. It's not something that we're actively recommending. The rapid tests, though, may also be used by homes on symptomatic individuals, for example, to enable return to work. So there are other uses for those rapid antigen tests. So there's still an opportunity that homes might be using those tests over the coming months, and in particular as they implement their policies to wind down the asymptomatic testing requirements of the ministry.
Okay. So Erin, back to the volunteer masking question.
Yeah, so I just wanted to pull the proper language from our guidance document in confirming that long-term care staff, volunteers, and student placements are not considered visitors. So volunteers need to abide by the same protocol as staff.
Okay, excellent. Thank you for clarifying that. And so now we've got a series of questions around visitors and visitation. So the first one I'll start with is if you can define the visitor level, so essential caregiver visitor and other definitions of visitors within long-term care homes.
Sure, Erin might be able to dig up the specifics in the guidance document, but while she's doing that, I'll start.
I have it here if you want. I have it here if you want.
Go for it.
So for essential visitors, it says, and excuse me for looking over on the screen, I'm just reading directly from it. So there are 4 types of essential visitors as defined in the Fixing Long-Term Care Act. So a caregiver as defined in the regulation, a support worker who visits a home to provide support to the critical operations of the home or to provide essential services to residents, a person visiting a very ill resident for compassionate reasons, including but not limited to hospice services or end-of-life care, and a government inspector with a statutory right to enter long-term care home to carry out their duties. So those are the 4 categories of essential visitors. And then outside of that, a general visitor is a person who is not an essential visitor and it is visiting the home to provide non-essential services related to either the operations of the home or a particular resident or group of residents. So general visitors include those persons visiting for social reasons, as well as visitors providing non-essential services such as personal care services, entertainment, or individuals that are touring the home.
Okay. So if a home were in outbreak, what are the restrictions on visits and visiting during an outbreak?
Sure, I can take this one. So first and foremost, a home would be working really closely with their local public health unit who provides direction to a home on how to manage each particular outbreak, recognizing that the circumstances of the home and of the outbreak may be unique. With respect to caregivers in particular, we do have pieces in our Act and regulations that specifically state that essential caregivers should continue to have access to the person they're visiting in the long-term care home during an outbreak. So where the local public health unit, though, might provide direction, is not permitting general visitors access to the home during an outbreak, or it might just be to a particular unit in the home based on the circumstances of that outbreak.
Would it be during an outbreak, are homes able to limit the number of essential caregivers who would have access to visiting a resident to provide care?
So the ministry removed the restriction. So we previously, I guess as of tomorrow, it will change. So we previously did have a restriction with just one caregiver at a time. So not a total number. There was no restriction on the total number currently, but we were restricting just one caregiver at a time. That's one of the changes that we're making as of tomorrow. So it will be up to the home working with their outbreak management team and the local public health unit to determine if there needs to be some level of restrictions that might be based on the size of the space, et cetera. So there is opportunity for the home to also have some policies around visitor and caregiver access during an outbreak, but that would be in close consultation with the local public health unit and the circumstances of the outbreak.
Okay. What about, are there any restrictions on unvaccinated family members visiting indoors or young children?
So in terms of the vaccination policies, from a ministry's perspective, there's no restrictions or requirements related to vaccination status. We do have outlined in our guidance document that vaccination policies should not apply to those under the age of 5. We have communicated to homes that this is an opportune time to reassess their proof of vaccination policies and consider permitting visitors and staff, regardless of their vaccination status, but to also engage with their family councils, their resident councils, their public health unit around what's the best decision for their home.
Okay. So are homes required to consult with the family or resident councils before making changes to the safeguards and the policies regarding testing, masking, visitation, and so on?
Yeah, so in terms of like the changes that the ministry has put forward, so we've removed specific requirements from homes, and we expect homes to follow the requirements of the ministry. I think where they're going above and beyond the requirements of the home, that's where we've communicated to homes that they should be engaging with their family councils, their resident councils, their public health units, as well as also seeking advice from their own legal counsel around those types of decisions.
Okay.
Just Sam, to loop back there on the vaccination policies, I also wanted to include a note. Christine mentioned that vaccination policies, should a home choose to have them, are not to apply to children under the age of 5, but they also are not to apply to outdoor visits and individuals visiting residents who are receiving end-of-life care.
Okay, good to know.
Thanks, Erin.
So if the home creates its own policy, which would caregivers follow? For example, a home isn't an outbreak, they're requiring COVID tests every other day. The home is also requesting families book in advance 48 hours prior and limit the number of visitors to 2 at a time, including the caregiver. So can the family member challenge that policy, or are they required to abide by the home's specific policy?
In our regulations, we do require homes to have a visitor policy and ensure that they're communicating that with their community. So that would be kind of a decision within the discretion of the home. I think if a family member is having a challenge or an issue with a particular home, I really encourage you to engage with, if you're not part of the family council, maybe connect with the family council to see how you can bring forward that issue to the home and work collaboratively with the home. I think if the issue is, if you feel like it's so significant that you think it might be breaching on a resident's rights, for instance, a resident's rights to receive a visitor of their own choice, the ministry does have a formal process where you can file a complaint, and we would have inspections go in and assess the situation in terms of whether the home is indeed following all the requirements under the Act and the regulations.
Okay. So going back to in around entering the home, taking tests and symptoms. Will there be any, this is coming from a couple of questions, would there be any repercussions for staff, visitors, or caregivers who knowingly enter the home while sick?
So yeah, so everyone should be self-monitoring for symptoms and not showing up to work when they're sick. Licensees, the ministry holds the licensees, which are the homes, accountable for following policies. So I think there'd be like an employment consideration there, but so the ministry has the obligations on the home to ensure that staff know that what symptoms to look out for and to not come to work when they're sick with really any infectious illness, not just anything that has specific COVID related symptoms.
Okay. So then would screeners be, if homes are still using screeners, be expected or required or not to ask visitors to take a rapid test if they can see that the visitor has symptoms, even if they're saying that they don't? So what would be the role of the licensee in at that point of if they think that someone may be ill?
Yeah, I think a couple of thoughts on that. So one, to clarify, homes are no longer required to have screeners at the door. So there may not be that individual person at the door, but if a staff person doing the screening, but if a staff person does observe someone who is ill in the home, they should advise that person to leave the home. Also, all visitors coming in should be wearing a mask throughout the home, minus the one exception when they're visiting alone with the resident. So it would be upon the home to ensure that if they are observing someone with symptoms, to advise them to leave the home.
Okay. Okay. Are there any special considerations for shared rooms? So to ensure that a roommate doesn't contract COVID from another visitor, or is there anything around IPAC protocols that are related to shared rooms?
So I can take this one. I would say specifically related to shared rooms in general, the IPAC standard set out for long-term care homes applies to IPAC practices that are relevant for all areas of the home and not just specifically in shared rooms. That's including hand hygiene. And right now, currently in our minister's directive, there is still the requirement of homes to have biweekly IPAC audits to ensure that they're up to date with their IPAC standards. And the homes are actually conducting weekly IPAC audits if they are in instances of outbreak. So specifically only speaking to shared rooms, there are not specific IPAC standards, but the IPAC standards in general in place by the ministry apply to all areas of the home.
Okay.
Yeah, the only other thing I would add to that is that homes, as part of their emergency plan, also need to think about areas to isolate individuals who are ill. So they should have areas that are set aside and a plan for how they would isolate. And they would be working with their public health units as well to ensure they have a plan in place should an outbreak occur, or when there is an outbreak, about how best to keep those who have been exposed or who are ill away and cohorted from away from those who haven't been exposed.
Mm-hmm. Okay. Are long-term care homes required to provide masks upon entry, or are caregivers and visitors responsible for bringing their own mask to the home?
So the masks that are required to be worn are provided by the ministry. Long-term care homes are to be providing masks, as they need to be medical grade masks for individuals entering the home.
Okay. What if you come up to the door already wearing a medical grade mask? Would you be required to replace your mask with one provided by the home?
Yes, because there's no, I would say it's likely that the home doesn't know the standard of where that mask has been, and for IPAC purposes, homes will provide you with a mask of their own at the door to use.
Right. So can a visitor, a family, a caregiver have a meal with a resident in a closed room?
Do you want me to take this one, Erin?
Sure.
So yeah, so once we made the change that permitted as an exception to the universal masking rule, the ability for family members to remove their mask when they're alone with the resident in their room or designated space, that does enable them to share, a meal, a cup of coffee. However, if there are, another resident in the room or a staff person in the room, then masks need to be worn by all visitors at that point.
Okay. All right. Would they be able to share food or a meal in a designated dining room where there are other residents gathering? Is it only in a room with just that resident, just for clarification?
Yeah, so at this point in time, it's only if they're either in the resident's room or in a designated space in the home where it's just with that one resident. As soon as there's other residents that are around or other staff, then the masks need to be worn.
Okay, so with social distancing no longer required, could residents resume gatherings? For example, having a performer come to do a concert, and if so, can family members join that event?
Yep. So with no longer the need to optimize for physical distancing, gatherings can occur. There's no limit on the number of gatherings. However, that is up to the long-term care home and the public health unit based on the space and obviously in accordance with other regulations such as fire codes and stuff like that. But the requirement for visitors to remain masked, they're more than welcome to attend those gatherings or the entertainment or what may be happening in the home, but they do need to remain masked at all times.
So could residents from different units within a home, say different floors, different neighborhoods, can they gather together for food, beverage without social distancing, or is cohorting still required?
So cohorting is no longer required except in an outbreak situation. So definitely residents can gather amongst various units or floors. But again, if the home is an outbreak or a unit's an outbreak, then different practices would apply based on the direction of the public health unit.
So just another point of clarification, if there's a social event like a birthday party, Mother's Day tea, residents could participate in food and drink and be unmasked, but caregivers and visitors would need to be masked.
That's correct.
Okay. Okay. This is a good question. What about bringing pets to visit the resident? If they're in a resident's room, can people bring pets in?
So we actually had this question earlier this week and we were just I'm looking to see if my colleague has the answer because she was digging into it earlier, but I believe it is up to the home and we're looking at the regulation standard. So that is something also that we can circle back with you on. If that you want to email our MLTC pandemic response inbox, we can get back to you on that one.
Just to add, I don't think there's any COVID specific policies that relate to the scenario of bringing in a pet. So it's more just what general rules the ministry would have around that.
Okay.
Okay. Oh, we just got the answer. So in the regulation, there is every licensee shall ensure that there are in place written policies respecting pets in the home. So that goes along with the visitor policy. Each home has their own policies, so you can consult with your home on their policy regarding that.
Okay. All right. Okay. What if so now turning to family council specific, can family council members meet in the long-term care home, and if they're in a closed meeting room, remove masks and share refreshments, or are they required to keep their masks on in a room where there are no residents present?
So currently at this time, masking is required at all times by any visitors or staff, even when they're not in an area with direct resident interaction. So that even applies to staff in administrative offices or to resident council or family council members meeting. I will say, and I did see kind of a question scrolling around, like what's happening in the next phase? He said this was the first phase, the next phase. So I'll just kind of tie in the answer there. One of the things we are looking at though, and working closely with the Office of the Chief Medical Officer of Health as part of that next phase is what do masking requirements look like in the long run? We've received questions, when can staff start using the staff gym without using a mask? When can family members enjoy a meal in the communal dining space with a resident again? So these are all things that are we're actively looking at and working towards see what the best approach is, kind of trying to balance the well-being elements with the protection to the health and safety. The advice we have right now from our public health experts is that masking remains essential and critical as that layer of protection in homes right now, and that's why it remains in place with this phase.
Okay. All right, excellent. Thank you. Okay. Is there going to be any, is mask funding going to be withdrawn? And is there, or is there any other changes pending because of provincial pandemic funding being changed and withdrawn?
Yeah, so the coming out of the budget that was announced last week, the ministry did communicate with homes that the COVID specific prevention and containment funding that the ministry had been providing, which was always intended to be a short-term program. So that is ending as of March 31st, as of this fiscal year, and going forward, homes would be accessing their base funding allocations to pay for these additional expenses related to like cleaning, masking. The ministry has also made an additional several other investments in IPAC and staffing type programs. So the message that the ministry has provided to homes is to be working kind of within their base allocations, reflecting these new investments to continue to pay for any of those costs that might continue, and recognizing that we have ended a few of those as of tomorrow, a few of those requirements. Yeah.
What if homes need a few more weeks to implement and make changes? Or is there any emergency funding that might be available for homes?
So if homes need a few more weeks to implement, I think the ministry can appreciate that, especially when there might be like staffing involved and contracts, et cetera, or just even times to update their policies. The homes would be, it wouldn't be through the prevention and containment funding because that does end as of March 31st, but it would be through the existing kind of mechanisms for paying for costs. Like homes also had costs for doing infection prevention and control and supplies prior to the pandemic as well. So it would be, as part of regular business, if you will, going forward.
Is there anything being looked at for improving air quality and circulation in homes, given that COVID is airborne?
So the ministry has shared there's an HVAC 10-point plan with homes a few times to ensure that their HVAC systems are running optimally to reduce that risk. Also, the ministry provided all homes that have 3 or more residents in a room with HEPA units, and HEPA units have also been installed in common areas. So those are some of the ways from like a ventilation perspective that the ministry has been supporting homes.
Okay. So speaking of changes to the ward rooms and to also emergency planning. So we've been hearing that the isolation rooms that are supposed to be for emergencies have been being filled with residents who are leaving hospital. So what are the requirements for keeping isolation rooms available really to respond to outbreaks in shared rooms?
Sure, that's a great question. So there's kind of like 2 things that are happening happening there. So one, the ministry made changes to no longer require homes to kind of set aside 100% of the time specific designated isolation rooms, to open those up so that more people who need access to long-term care could access those spaces and get the right level of care to meet their needs. However, the ministry does also maintain requirements for homes as part of their emergency planning to make sure they have a plan on how they would isolate residents should there be an outbreak. So they are still required to have a plan. It might not be the same room that they'd previously used. It's kind of opened up more flexibility for homes to figure out what would work best for them in terms of setting aside areas of isolation should an outbreak occur, as opposed to the previous one, which was very specific around setting aside isolation rooms.
Okay. Okay. Going back to HVAC, how would a council or a home know that the HVAC system is in place and has been checked to ensure that it's functioning properly?
So the home would have maintenance that would be responsible for assessing it, and usually there's kind of seasonal maintenance that's required to ensure it's up and running, especially before kind of the summer and the winter, before we do like those major changeovers. We have various types of homes in terms of age and structure, so they all might have slightly different HVAC systems, but they would all have kind of a maintenance person or maintenance crew that would be responsible for maintaining that.
Okay. So just to clarify, there is not a current vaccine mandate for staff or visitors or caregivers?
So there is not one from the ministry, but
Okay.
homes are still within the purview to have their own vaccination policy or requirement. It has been recommended to homes by the ministry to reconsider their vaccination policies right now, given the current context of the pandemic and the
Okay.
residents' right to receive visitors of their choice.
Okay. Going back to masking, can you define medical grade masks? Are we looking at the blue surgical masks, N95s, or what is the standard, and does the mask use depend on vaccination status?
So the medical mask or surgical mask, we use kind of those terms interchangeably. It's not an N95. The N95 is recommended in specific circumstances. For example, if you're directly interacting with someone who has COVID-19 or who's isolating as a precaution. So the N95 is not required at all times. It's like that blue, often blue, could be a different color, medical mask.
So if someone visits a home wearing an N95, they'd be required to take that off and put on the blue mask. Could they put the blue mask on over the N95?
That is a good question. I'm not sure. Erin, do you know?
No, it's actually less safe. We've had this question before to wear two masks because it can create friction in between the masks. So it is not recommended by the Ministry of Health that individuals wear more than one mask. In terms of an N95, use of an N95 is based on a point of care risk assessment in someone's proximity to dealing with someone who is symptomatic or an individual who may have been exposed to COVID or have COVID-19. So in that instance, an individual could request to use an N95 based on their own point of care risk assessment on the situation.
Okay. Okay, going back to isolation space in a potential outbreak. Are homes given options, and I'd say, or guidance on which spaces can be used as temporary isolation rooms should there be a future outbreak and they don't have any dedicated isolation rooms available? And does the ministry provide portable HEPA filters for such emergency plans?
That is a very specific scenario that I do not know the answer offhand. I don't know if Erin, if I saw you come off mute, if you had anything to add.
In terms of if there's specific areas that homes are guided to designate as isolation areas, that is not something that the ministry outlines as the homes are very, very different in terms of size and available space, so that the flexibility there is for homes to be able to identify the areas for isolation for themselves.
Mhm.
In terms of the HEPA filter piece, that is not something that I have the answer on, but we can also circle back on that if the individual would like to email us.
Okay. Okay, just looking for other questions. So you mentioned this towards the beginning, but stopping daily temperature checks, is that something that is required for homes to do or not do? As the person submitting the question saying their temperature checks are non-intrusive and can be simple to do while helping residents get ready in the morning or throughout the day.
So temperature checks have been removed at the advice of the Office of the Chief Medical Officer of Health because they are, yes, they are non-intrusive, but a fever or a temperature is not the first sign or symptom indicative of COVID-19 symptoms. So the reason we've resorted to daily symptom screening or monitoring as per the IPAC standard is because that is a better way to get a wholesome picture of resident symptoms in looking at that. Also, additionally, there are often residents who take acetaminophen or Tylenol regularly, which would mask instance of a fever. So it's a more wholesome picture to do a daily symptom monitoring as opposed to the temperature check only.
Yeah, and just to add to what Erin said, just to reiterate, it's the ministry's requirement to do daily temperature checks that has been removed as a specific COVID measure. Homes may continue to check a resident's temperature just as a general practice as part of their daily kind of vitals checks, or so that might be a practice, but it's not something that homes need to now do specifically for COVID purposes and purposely report and record it for the purposes of meeting this ministry requirement.
Okay. If you have a private or separately paid caregiver for a resident, are they permitted to care for different residents within a particular time frame if the home isn't an outbreak? Or are there any restrictions on the use of private caregivers right now?
Yep. So that kind of goes back to the cohorting question. There is no cohorting ministry requirement when not in instances of outbreaks. So provided the home is not an outbreak, there's no ministry requirement prohibiting an individual from going to two different wings.
Okay. Some questions are requesting clarification, so they're pretty quick to answer. So for staff or family council meetings, are people no longer required to maintain 6 feet distance? So is physical distancing still a requirement?
So in our guidance document, so you no longer need to maintain physical distancing for staff or for family council members if they're having a meeting. The one caveat to that is, and Erin, maybe you can dig up the specific language. I think we talk more specifically about staff, so I don't know if it applies to family council members, but maybe something we can take back is that staff may remove their mask if they need to eat or drink, and if they're removing their mask, they need to maintain the distancing.
Okay.
But we can look into what the application is for family council members. I think it's pretty specific to staff in our guidance document, but that's something we could certainly take a look at.
So will the ministry still be providing PCR test kits if they need to administer those in long-term care?
Yeah, so testing of people with symptoms through PCR testing continues to be something that we're doing. So what's ending is the asymptomatic testing as a kind of routine measure and requirement. The testing of residents if they're sick, that'll continue. And it's also available for staff or caregivers, or you can access PCR testing in the community.
Okay, so after the end of June, if a home decides to continue with rapid testing, they would be responsible for paying for those kits. But if it's the PCR, that would be funded?
Correct.
Okay.
Yeah.
Okay. And then just to clarify, screening is being removed along with rapid antigen testing for asymptomatic people. Active screening.
That's right. So active screening where you have a person at the door, or maybe it's a digital approach to confirm like you don't have any of these symptoms and you haven't been near someone who has COVID in the last however many days. So that active screening, those requirements are ending. What homes are required to do though is to support passive screening or self-monitoring. So signage at the door, have a plan in place and ensure they're communicating with staff and with their kind of visitors, family, the community on what to be looking for, and using tools such as our, there's a screening tool that they can use to self-monitor for symptoms at home.
Okay. Okay. And to clarify, residents don't need to social distance when eating with other residents. Is that accurate?
That's
Yep,
correct.
that's correct.
Okay. So a couple questions regarding possible new things or changes in the future. Some homes are already investing in new entrance signage that mentions indoor masking and other IPAC protocols. But of course, this may change again soon. Do you have any sense around the timing of new or changes? Is government looking at waiting a certain amount of time before revisiting, or is this much more of a rapid response approach?
Thanks for the question, and challenging for us to say exactly when the right timing would be. It's something, like I mentioned, we're working closely with the Office of the Chief Medical Officer of Health in terms of what are the right measures kind of in that longer term. I don't anticipate that this will be something that comes out in the next, if I venture to guess, in the next couple of months. Like no decisions have been made. We don't have a proposal yet. So it's still very early stages, but I wanted all of you to be aware that this is active thinking that we're still doing, and that it's not necessarily going to end here. And we want to continue being responsive to how the pandemic evolves. We want to monitor the impact these changes have in terms of outbreaks and the size of outbreaks before we consider introducing any other changes.
Mm-hmm. What about, there have been some recent studies on predicting outbreaks based on wastewater or mopping within homes. Is there any thinking around implementing those measures or those approaches across all of the long-term care homes in Ontario?
Yeah, so the Office of the Chief Medical Officer of Health and Public Health Ontario, they do closely monitor the wastewater signals across the province. However, the advice we've received from public health is that following the wastewater just in very specific institutions actually does not necessarily lead to like a particular outcome to better protect residents. So really it's what's most effective, one like vaccine, the antivirals, the masking, the IPAC measures are really the best measures to protect against transmission of infectious illnesses. It is something that's monitored though at kind of a more of a macro level to get trends in the pandemic and see if if we're kind of in an upswing in terms of community transmission levels, which becomes important because the outbreaks happen in the home generally because the virus is being brought in from the community. So we do monitor what's happening at the community level, and wastewater signals is one of the inputs into that.
Okay, so going back to visitors, people coming in from the community, if you have a visitor who has perhaps is immunocompromised, medical reasons, can they request that for their safety they wear an N95 while in the home?
I feel like this is one we should just go back and check with our public health officials just to make sure we get right. So maybe this is one we could follow up with you on. I don't know, Erin, if you had any, but we don't specifically articulate this scenario in our guidance
Mhm.
document.
Yeah, I would say that
Yeah.
there's a nuance to that scenario, and it's actually in the long-term care guidance for public health units that it's based on a point of care risk assessment. So that piece that I was speaking about earlier. So yeah, if we could circle back on this one about this unique situation, that would be great.
Great. Visiting hours. Can homes restrict visitors to certain visiting hours?
Yeah, so this would go back to the home's visitor policy. So it would be up to each home in terms of what their visiting hours are. I'm pretty sure we don't have specific requirements in our regulation around visiting hours, but Erin's looking at me like she might have
I do have more to add.
more to add.
So
So
the only thing is that homes cannot restrict or deny caregivers. One second, there is a piece. I'm looking for the exact wording for you guys. Yeah. So homes may not require scheduling or restrict the length or frequency of visits by caregivers. So if a visitor is designated as an essential caregiver, then they cannot be restricted based on hours.
Okay, good to know for all the essential caregivers. So they cannot restrict the caregiver access.
Correct.
The essential caregiver. Okay, excellent. Just clarifying that. Okay, so I'm going to put out a call for last quick questions as we are getting to the end of our time together. Couple questions that might be outside of the scope here, but we'll pose them. If staff contract COVID at work, is that sick leave under WSIB? Are homes required to give paid sick leave to staff? How would that work, if you know?
I think it'd be based on that employment contractual relationship. So we have some homes that are in unionized environments. Some staff are, agency staff. So I think it's a unique response based on the kind of employment relationship between that staff person and the long-term care home. The Ministry of Long-Term Care does not have specific requirements around sick leave. And I don't know, Erin, if there was anything else to add to that.
No, I think you covered it.
Okay. Okay. Are there any restrictions on the number of times a resident who is in isolation, if their roommate has contracted COVID, be tested? Are there any guidelines on frequency of testing for a presently asymptomatic resident whose roommate has COVID?
Yeah, so I don't know if Erin, if you have the information handy, it is in the Ministry of Health guidance document around case and contact management.
Yeah, so
thank you. Yeah,
it's a chart to follow. So I don't without having to read the entire chart, but you're saying the person is an asymptomatic roommate.
Mm-hmm.
Close contact. Okay, let me just, sorry.
I know there is isolation requirements.
Yeah, so for a total of 7 days after the last exposure to the COVID-19 case, there's a close monitoring for symptoms, so twice per day, and then they are to wear a well-fitted mask if tolerated and physically distance from others as much as possible. And in terms of their isolation and testing, they're to isolate until they have a negative molecular test taken on or after day 5 from the beginning of the isolation period.
Okay, great. Last question is just going back to clarifying around ward rooms. So if there is a ward room that would have prior had 3 or 4 residents in that space, the above 2 beds are to remain vacant and are not to be filled by any new residents. Is that correct?
That's correct. So the only time where there might be 3 or more individuals is people who were already in that space before the ministry made that change.
Okay, Great. All right, that's, I mean, according to my count, answered tens and tens of questions. And I think that speaks to how important this issue is for everyone. So as it is now at the end of our time together, I just want to thank you, Aaron and Christine and Anastasia, for running slides in the background and being here as a support. And it brings us to the end of our time together. And on behalf of the attendees, a thank you as well, as many have thanked you in the Q&A as well. As I said before, this session has been recorded, original date of March 30th, 2023, and will be available on the Family Councils Ontario YouTube channel, and the link will be sent out in our e-bulletin, along with a French version of the slide deck when available from our ministry partners. So once again, Aaron and Christine and Anastasia, thank you so much. And if there are any other follow-up questions, you can reach out to me, and I can provide anyone with the email address to reach the pandemic response folks at the Ministry of Long-Term Care.
Great. Thank you so much. I greatly appreciate the opportunity to answer your questions.
Thanks so much. Take care, stay safe, be well, and have a great rest of your day, everyone.
Bye.
Have a great one.